Hello everyone, this is the continuation video of Goniometer, and in this video we are going to study about planes and axis of the joint motion. Before entering into the axis and joint movement, we need to know about osteokinematics and orthokinematics of a joint. Osteokinematics are the movements which happens between the shafts of the bones, and orthokinematics is actually the movement which is happening at the joint surfaces. This could be of three types, either a gliding or a sliding or a rolling movement. This can either happen independently or in combination of any two also. Goniometer measurements has to be taken in consideration of the axis and planes of the joint movement. Actually, our body movements happen in three axes and three joints, three axes and three planes. The axis and the planes which acts at the right angles of each other. There are three cardinal planes in which the movements happens. One is sagittal plane, the other one is frontal plane, the other one is transverse plane. And there are three axes, medial, lateral, anteroposterior and vertical axis, which will be at the right angle for each other and to the corresponding planes also. The sagittal axis, which divides the body into either halves, right or left, and the frontal or coronal plane, which divides the body into front and back side, and the transverse plane, which divides the body into up and lower, or dorsal or the ventral portion of the body. These are the planes and axes at which the joint movement happens. The range of motion, which is defined as the movement or the amount of motion which is available at any given joint. There are various movements which happens, either it could be an active movement or a passive movement. Passive movement will be performed by an examiner on a patient, or the active movement will be done by the patient or the examinee by himself. And there are so many determinants which determine the joint range of motion. Normally, the age, gender, the activities of daily living, the right or the left body physique, active versus passive movement, all these movements or these factors which determine the range of motion. Age, the younger age will be having more flexible than the older independents who might not be having that much of flexibility in the range of motion. Similarly, females will be having more flexible range of motion than the males, and certain activities of daily living will be determined with the limited range of motion than the other. Similarly, left will be having little bit of lesser range than the right while comparing the active one, and the body physique also is a major determinant in determining the range of motion while comparing with the active and passive. Both will be having different range, while the passive we could able to reach furthermore than the active. And there are few abnormal parts also which determines the range of motion to a certain extent, like adhesions, muscle insufficiencies, tight soft tissues which are around the joints will also be having lesser range of motion impact. And before entering into the practical session of the range of motions determination through goniometer, we need to know the range N field. N field are the field which will be experienced by the examiner on the examinee at the N range of passive range of the motion. There are few certain normal and abnormal range of motion N fields at the end of the range of motion. The normal could be either soft, firm or hard, and these occurs at the specific range of motion and at the specific joints. If these normal N fields happen at an abnormal areas, like where a joint is not been meant for that N field, then it will be labeled as abnormal. Majority of abnormal N fields will also be either soft, firm or hard. Added to it, it will be a springy block or an empty N field will be added. These are the end fields. Normal or hard, bone to bone. Soft will be soft tissue approximation, and tissue stretch will be firm. And these are the abnormal, which are added to hard, soft and firm end fields. Like an example for bone to bone hard end field is during elbow extension, the olecranon process which goes and gets stuck at the olecranon fossa will give an examiner a feel of hard at the final range of motion. And similarly, for soft tissue approximation, soft end field, it is for either at the elbow flexion or at the knee flexion. The examiner will be feeling of a soft end field by the approximation of the two muscle bulk. Then it will be labeled as soft tissue approximation. There is an end field which is labeled as firm, where an examiner will be determining an end field which with an elastic resistant or a stretchy or a firm kind of resistant at the end range of motion, which usually happens at the shoulder joint or majority of the joints, which an examiner will be feeling due to a capsular stretch. These are the normal end fields which are meant for almost all the joint end range. And if this range happens abnormally or not at an not expected joints, then it will be called as abnormal. Like early and late muscle spasms, these are the spasms which happens at the initial or at the end range of the motion. And there are few soft or the joint which are inflamed, which will be having too much of inflammation, which will not be giving the final and full range of motion, which the examiner might be feeling as in soft or a bogey kind of end fields. And there are end fields which are called as empty end fields. These are the end fields which the patient will be restricting the range of motion due to an excruciating pain. Because of pain, the patient may not be letting the examiner to perform a range of motion, and to that part we label the end field as empty. And springy block, which we label, these springy blocks are the examiners might be feeling a kind of restrictions at or between the range of motion, restricting by and torn or a hindering meniscus in any dearrangement syndromes of the knee joint. These are all the abnormal end range of motions, end fields, which an examiner usually feels at performing the range of motion. And these are the factors which determine the reliability of goniometer. There are environmental variables and patient related factors also. Environmental variables depends on the time of the day. Environmental variables and patient related factors also. Environmental variables depends on the time of the day where the range of motion or the goniometer is being performed, and the temperature and the kind of goniometer which is being used, and the experience of the therapist. The temperature, if it is colder temperature, the range of motion would be little bit less than the hotter temperature. The kind of goniometer, it is purely subjective experience, where the experience of the therapist purely plays a vital role. And the patient related factors like reaction of pain and fatigue. Patient, when they are having excruciating or extreme pain and fatigue, their range of motion will be reduced or will be diminished, which may not be properly been determined. And feeling of fear or tension, or in a case of stress also, the patient will not be able to execute the movements in a more perfect way, and the reliability of goniometer will be a very big question mark. Since it is the goniometric measurement is going to be a subjective one, all these determinants has to be properly addressed.